and welcome. I'm trying to learn medicine. Today, Antepartum Haemorrhage. And after we've done it, we're going to do leg injury prevention training. And if you participate in the leg injury prevention training, then it's at your own risk. And we're talking about something affecting pregnancy and also with a fatal outcome of pregnancy, and also blood system, blood and bleeding, and also about genitals. And this is no medical advice, we're just reading about it. Now this is part 2 of Antepartum Haemorrhage, which we're doing here. Now we're trying to gather the informations together, which we have listed here, and then to learn them and try to save them then in a separate video. So Antepartum Haemorrhage. Any bleeding from the vagina that occurs during pregnancy is antepartum hemorrhage. So bleeding from the vagina during pregnancy. It may well be symptomatic of a condition that is serious for mother and baby, and a doctor should be summoned right away. It can be the symptom of a serious condition for the child carrier and the fetus, and the baby. Symptoms. Any blood loss during pregnancy. The loss may be heavy and contain clots. Okay. Duration. How long the bleeding lasts will vary from case to case. Causes. If the hemorrhage occurs during the first 3 months of pregnancy, it is usually due to a threatened miscarriage, which is common, or a complete miscarriage. Okay, they're writing here C, abortion. Now we're going to talk also a little bit about abortion. The chapter is long. I think they're talking about spontaneous abortion. There are no precise numbers for pregnancy that fail, but medical research has shown that probably about 1/3 of all pregnancies abort spontaneously within 4 weeks of conception. In many cases, the woman never knows that she has been pregnant, for the abortion occurs about 4 weeks after her last menstrual period and so passes unrecognized. In other cases, abortion may occur a week or so later, and she, so the patient, the woman, just thinks that she has a late period. Spontaneous abortions may be nature's way of terminating a pregnancy that is in some way likely to be unsatisfactory. My book is from the 80s. Okay, symptoms. In the early stages of spontaneous abortion, the commonest symptom is loss of blood from the vagina. This may be bright red if it is fresh, or brown if the blood has been retained in the vagina for some hours. Now again, this is no medical advice, I'm just reading about it. If the embryo has not been dislodged, it is, at this stage, a threatened abortion, and the pregnancy may still be saved. Okay, let's read it again. If the embryo has not been dislodged, it is, at this stage, a threatened abortion, and the pregnancy may still be saved. If the condition becomes worse, pain may come and go at regular intervals like small labor pains. This is a sign that the threatened abortion may become inevitable if the embryo is dislodged. Okay, I don't completely understand it, but I think we understand what was written at the other page. Now again, for completeness, this is no medical advice here, and there are other types of abortions. This was no spontaneous abortion. We have also the chapters here for incomplete abortion, missed abortion, septic abortion, habitual abortion, and therapeutic abortion. Now, antepartum hemorrhage. If a hemorrhage occurs during the first 3 months of pregnancy, it is usually due to a threatened miscarriage, which is common, or a complete miscarriage. We're just going to say as well, right? Because of a threatened miscarriage or an already happening miscarriage. Otherwise, it is usually due to placenta previa or detachment of afterbirth. But that would be after the birth, the placenta. Placenta previa, I don't think they write something like that. placenta previa. An abnormal condition of pregnancy in which the placenta, the afterbirth, which nourishes the fetus, develops not in the upper part of the womb, but in the lower. Its danger is that it may obstruct the passage of the fetus and cause heavy bleeding during labor. Okay, let's read it again. It is an abnormal condition of pregnancy in which the placenta, which is the afterbirth, but after it had been born, it is the afterbirth. No, it is here also the placenta, which nourishes the fetus, develops not in the upper part of the womb, but in the lower. Its danger is that it may obstruct the passage of the fetus and cause heavy bleeding during labor. So we understand it at least. What would we mean here? So if we're having here, otherwise it is usually due to placenta previa or detachment of afterbirth. Yeah, we understand what we mean here. Because of placenta previa, where the placenta is in the upper part of the body instead of the lower part. That is what I did here. I think that was right. But I want to say that when other people won't understand it. Develops not in the upper part of the womb, but in the lower. It develops in the lower. So there we go. Where the placenta develops in the lower part instead of in the upper. It can obstruct the passage of the fetus and cause heavy bleeding during labor. Obstruct the passage of the fetus, causing heavy bleeding. What are we doing? I can't find it otherwise. Antepartum Haemorrhage. Okay, it can be because of a threatened miscarriage or already happening miscarriage, or it can be because of placenta previa, the placenta had developed in the lower part of the womb instead of the upper one. And that can obstruct the passage of the fetus and cause heavy bleeding. I think I said during labor. And it can be also detachment of the afterbirth from the wall of the uterus, which is the womb, due to toxemia of pregnancy. Okay, we have the third reason was because the placenta had detached from the uterus, from the wall of the uterus, due to toxemia. I don't think I know what it is. Toxemia. Okay. Threatened or miscarriage, placenta previa, too much down instead of up, and detachment of the placenta from the uterus walls. Receive treatment in home. Rest in bed until the doctor arrives. Keep any blood clots that have been passed so that the doctor can examine them. Summon the doctor as soon as any bleeding occurs. Prevention. All unnecessary strenuous activity should be avoided during pregnancy. If a woman, so a pregnant woman, is in doubt about any activity, she should discuss it with her doctor or midwife. But that is overall more written. I don't know if he should mention that another antepartum hemorrhage. That is more overall. I think that would be misleading a little bit. If it's most of the case because of threatened miscarriage or miscarriage, there's a thing with the placenta no, we haven't written about it. Outlook. The outlook for mother and baby depends on the cause, but is usually good, provided the doctor is consulted immediately any bleeding occurs. Occasionally, antepartum hemorrhage ends in premature labor or stillbirth. We are staying away from the prognosis and also that, because neither this video nor the one which we want to record is medical advice, so we're just going to say to consult a doctor immediately if any bleeding occurs. Okay, we are. Let's try it. I'm going to start the second camera. Antepartum hemorrhage, that is any type of bleeding from the vagina during pregnancy. And if it happens, the doctor should be consulted immediately. The causes the blood should be kept, blood clots should be kept, and immediately a doctor should be called and the blood clot out. And it can be because of a threatened happening miscarriage, because of placenta previa, the placenta had developed too low in the womb and sit higher up, or because of detachment of the placenta from the uterus walls. Now I'm gonna again here. Not in the upper part of the womb, but in the lower. Okay, the womb. So the uterus. Its danger is that it may obstruct the passage of fetus and can cause heavy bleeding. Okay, I think we have it all together. This is about the serious and oftentimes maybe fatal condition during pregnancy, and also about blood. Antepartum hemorrhage is any type of bleeding out of the vagina during pregnancy. And the doctor should be consulted immediately, and also the blood and the blood clot should be kept to examine them. And the causes are a threatened abortion or already... That was actually right. This is about a serious condition during pregnancy, which can be fatal, and also about blood and genitals. Antepartum hemorrhage is any type of bleeding out of the vagina during pregnancy. And the doctor should be consulted immediately, and also should the blood and the blood clots kept to examine them. And the causes are a threatened miscarriage or an already happening miscarriage, or placenta previa, where the placenta had developed too low in the womb instead of further up, or also because the placenta had detached from the walls of the uterus. And that is according to Keith Hodgkin's Family Medical Advisor book, page 76, but this is no medical advice. I'm going to stop the camera now. And we are having fabulous 2.5 minutes for leg and intervention training. Now, if you were here for medicine, this was no medical advice. Then you can go directly to the next part of medicine. If you stay here and participate in the leg injury prevention training, that is very harmless. Stand good and swing one leg to the side in front. And the other leg swing it in front and to the side. And over the leg in front and back. And the other foot in front and back. And now breathe in, lift one leg up. Breathe out the leg to the side. Breathe again in. Out into the middle. And down. Again in the other leg up. Out to the side. Breathe again in. Out into the middle. And down. Again one leg up. Breathe in. And out go with the hands up to one side. And change. And both over. Also the knee now over. And down. And change the other leg up. With the hands over to one side. And over to the other side. And both over. And over. And down. Now breathe in and lift one leg up and press with the knee up and to the side. Up and to the side. And the other leg, press up and to the side. Now stand good on one leg. Turn slowly over to the leg. That exercise can go into the knee. Go down into the knee. Turn over to the other side. And come up again. And with the other leg. Stand good. Turn over to the leg. Go down. Go to the other side. And come up again. And we're ending. Legs wide apart. Breathe in and down. And breathe again out. Again in. Breathe in across the legs. And breathe again out. That was shortened leg injury prevention training. Thank you very much. In the next time.